Yes, good evening, participants. We welcome Dr. Randeep Rajkumar for his second day in a presentation. Excuses for some technological glitches. And sir, over to you for your presentation. Kindly unmute your mic, sir.
Hello, sir.
Yes. Yeah.
Okay, sir.
Yeah. Okay. Okay. Yes, we can hear you. Go ahead, sir.
Okay, sir. Thank you, sir. So,
Welcome.
uh, good evening, friends. Hello, sir.
Yes. Good evening, sir.
Good evening, sir.
Welcome.
Yesterday we discussed various disorders, especially developmental disorder. Part one, almost we are completed. Now we are entering into part two. We discuss about various other psychological disorder like anxiety, depression, bipolar, and PTSD, other disorder we simultaneously discuss. Now we are talking about the anxiety disorders. So, in various psychological disorder, anxiety disorders very common in our population, especially the prevalence rate of anxiety disorder most common among mental disorder. It affecting nearly 4% of the global population, especially India. Prevalence of anxiety disorder in adult population is 2.757%, especially in adolescent population. Prevalence of anxiety disorder in India ranges from 14.4 to 56.8, especially when compared to gender. Female population is higher than the male population, especially among various anxiety disorder. Social anxiety disorders are very highest common, especially 18 to 29-year-old age group populations. So, what is anxiety disorder? Anxiety, the feeling of apprehensive or fear. It may be the source of this uneasiness is not always common or recognized, which can add to the distress to feel. If the person have certain unwanted or complicated situation, the situation may give certain apprehensive fear which is not able to face. When in that period, the person may have a distress. The distress in cognitive aspects, this distress will develop certain biological progress within the body, that autonomic arousals are more on that. If autonomic arousal are more, the sympathetic nerve system will be more dominated, then the person may feel very apprehensive fear. What are the symptoms of anxiety disorder? So we make it as a two domain, the psychological symptoms and physical symptoms. If the person have certain fear or developing anxiety, they more have excessive fear, worriness about the difficult situation which is not able to control on that. Sometimes the person may have restless, that shows the irritability, anger. At the same time, they have a difficulty in concentration. Sometimes they have a racing of thoughts, followed by sleep disturbance. It goes to insomnia and nightmare. These are psychological symptoms. When come to the physical symptoms, the rapid heartbeat, normal heartbeat become an abnormal heartbeat, chest pain, sweating, trembling, and muscle tension, sometimes fatigue and headache, sometimes breathing difficulties, sometimes hyper breathing and hypo breathing. It is happening in the body. What are the common cause of anxiety disorder? One is the person will face some situation which is not controlled by themselves, or the situation which is not handled them. The situation, it gives some catastrophic thoughts. The situation develop fear and anxiety, the stressful situation on that. Sometimes when the person have prolonged conflict, intra conflict or inter conflict within us or within the environment, they may develop anxiety features. Then any financial difficulties, and sometimes the people who take excessive caffeine, that's also lead to anxiety disorder. Sometimes insufficient sleep, even nowadays getting sleep is highly difficult for everyone. People may not getting sufficient sleep. That sleep disturbance, sleep deprivation also develop anxiety features. And poor eating habit, sometimes people may skip morning breakfast, they're not taking meals on the time, not taking dinner on the time, late night dinner, all the things may have developed complicated, they create anxiety on that. Sometimes the people may feel that people are not recognized, people are not accepting, people are rejected me. These kind of uh, situations develop anxiety within the individual. There are different type of anxiety disorder. That is, one is generalized anxiety disorder. The person, whatever they thought, whatever they want to do, they themselves develop certain fear, avoiding certain situation in their personal life. That is called generalized anxiety disorder. Another one is social anxiety disorder, especially when the person face certain things in the community, or the person try to do something in the situation, they may not be comfortable to handle that particular situation. Sometimes the person may have stage fear or group, not able to participate in a group activity. Sometimes the person may not be present, what they want to do in the society may not be present, and that times may lead to some sort of catastrophic thoughts to avoiding the situation, particularly in the social aspects. Another one is phobia. It is very common nowadays in the general population as well as student population, getting fear, intensive fear, and because of the intensive fear, they are avoiding certain objects, certain activity, certain situation, and that lead to extreme stressful in the individual, may lead to phobias. Then panic disorder, the sudden alter in the body, the person may thought certain things, may want to certain things, they're getting catastrophic, they're getting panic on that. That is called panic disorders. When these type of disorders are very common among the population, we have to be classified this different type of anxiety disorder based on the DSM-4 ICD classification. Each disorder has certain features. If these features is fitted in either in the generalized anxiety disorder, or social anxiety disorder, or phobias, or panic disorder, these all subtypes comes under the anxiety disorder. What are the treatment available for anxiety disorder? The treatment in the sense, we have to go for detailed evaluation first. Apart from this, whether the symptoms in cognitive based or the symptom based, symptoms may extend into biological aspects, especially when you understand the nervous system, parasympathetic and sympathetic nervous system. The sympathetic nervous system, when the function in a crisis situation, parasympathetic nervous system will help to balance our autonomic arousal, and that even depend upon the triad. There is a state anxiety and triad anxiety. Sometimes the person, because of the situation, they're getting himself anxiety. Sometimes the triad itself, a biological function itself, they have biological vulnerability on anxiety. That particular person may have a more vulnerable autonomic arousal. If that will be more dominating biologically, then the person may go for some sort of pharmacology based treatment followed by non-pharmacology based treatment, that is called behavior therapy. If the person, there also we have to rule out by administering various anxiety scale, whether the person is mild anxiety, moderate anxiety, severe anxiety. But the severe anxiety, more biological complication. For that, they go for drug management followed by the behavior modification. But sometimes the person, the situation itself make anxiety. Once the situation is overcome or situation is crossed, once complete the situation, the person became a subside all the anxiety symptoms. But because of the coping mechanism, because of the trial, we taught the person to be more behavior modification like exposure therapy. Exposure is nothing but face the situation and handle the situation, and also sometimes the systematic desensitization. Systematic means they gradually expose the person to the particular situation. Even that situation, there is a clinically proved relaxation therapy is called Jacobson deep muscle relaxation therapy. This relaxation therapy is very much useful for anxiety disorder. At the same time, cognitive approaches. Everything is a thinking pattern. The belief system will make the person become more anxious. For that, the belief system has been modified through cognitive remodification technique that is called cognitive behavior therapy. With this therapeutic intervention, we can able to handle the anxiety disorder. Even for the social anxiety, social skills training, group activities, behavior modification, time management, stress management, all the technique has been taught to the person to handle the situation. Then the anxiety disorder become disappear.
Sir, excuse me.
Yes, sir.
Sir, just hold on for a second.
Uh,
Now, if you could share your PPT to my WhatsApp number, because the screen is too small and it is training we are unable to read the letters. Could you share your PPT to my WhatsApp number? I can share from my laptop.
சார் இந்த ஜூம் ஆப்ஷன் யூஸ் பண்ணுங்க சார். இதில் ஆக்சுவலாக அந்த பிபிடியில் பாருங்க, ரைட் சைட் கீழே கார்னரில் இருக்கும் பாருங்க, 100% இருக்கும். அது ஒரு 125 130 வைங்க சார். எஸ் சார். அப்படியே கொஞ்சம் கொஞ்சம் இல்லை சார், இன்னும் கொஞ்சம் குறைங்க. இந்த கார்னரில் மைனஸ் ப்ளஸ் சிம்பிள் இருக்கும், அந்த மைனஸ் சிம்பிள் யூஸ் பண்ணுங்க சார், அது கொஞ்சம் ஈஸியாக இருக்கும். இன்னும் கொஞ்சம்
ஃபைன் கோ ஹெட்.
இல்லை
நோ
இந்த மைனஸ் சிம்பிள் ப்ளஸ் சிம்பிள் யூஸ் பண்ணுங்க சார், அதை ட்ராக் பண்ணாமல். சார் இது ஓகேவா சார்?
இன்னும் கொஞ்சம்
எக்ஸ்ட்ரா குறைக்கணுமா சார்?
இன்னும் கொஞ்சம் கூட்டணும். ஜூம் பண்ணுங்க, ப்ளஸ் பண்ணுங்க.
ஓகே.
All right. Okay, go ahead.
Thank
you. Yeah, go ahead. Go ahead, sir.
Yes, sir. Now we'll go to discuss about the depression. So we all know depression is very common symptoms, very common disorder in our population. See, even depression is very common nowadays in young generation, especially children's, because we all aware about the various academic stress factor, interpersonal relationship factor, and family issues may vulnerable to develop certain depressive symptoms among the young generation. Sir, it is visible. It is visible, sir.
Visible. Go ahead, sir. If there is any problem, I'll contact you.
Depression is one of the mental health disorder characterized by persisting of sadness, hopelessness, and lack of interest and lack of pleasure in daily activities. These depressive phenomena or depressive features, it have an impact on our thought, moods and physical well-beings. It often lead to changes in our sleep, appetite, even on our energy level. Even in the depression is concerned itself, it is also differ in the symptoms, differ in different type of depression. Especially depression has been classified mild, moderate, and severe. Based on that severity of the illness, the treatment process will be proceed on that. Whether sometimes for the depression, psychotherapy is very much required. Sometimes both the drugs and psychotherapy is very much required. Sometimes the person with severe depression or severe suicide ideation, their first line treatment always preferred by drugs. Later, psychotherapy will be more useful to overcome on the depression on that. Prevalence rate of depression in India affecting millions of people. Depression rates are increasing, especially among young people. In 2030, the Lancet study estimated that 45.9 million people in India have depression, especially in the developing countries. In 2050, developing countries like India, depression is the first foremost disorder in other when compared to other physical disorders. What are the symptoms of depression? Sadness, lack of interest in daily life, loss of interest in enjoyable activity, that is called pleasurable activity, loss of appetite, feeling of anxiety. Sometimes people avoid to talk others, being socialization with others. Sometimes they develop problem in sleep. They have low confidence level. Sometimes they have feeling of unworthiness, guilt, learned helpless thoughts. Sometimes thought of suicide also, which is predominantly present on that. So there are different type of depression. One is called major depressive disorder. Another one is atypical depression, then bipolar disorder, then postpartum depression, then persisting depressive disorder, and premenstrual dysphoric disorder and seasonal affective disorder. These are all the different types of depression, which is very common in a depression. So, what are the major depressive disorder? See, each disorder can be diagnosed based on the duration of period. Say, the major depressive disorder, most of the days, they feel this kind of symptoms. Sometimes they may have at least 2 weeks. If the person, this kind of symptom will be prolonged 2 weeks, the symptoms like in the thought process, having a thought of death or suicide. There are two type of things are there: death wishes and suicide. Death wishes, they thought that I don't want to live in the world. God may easily took it me. That's more easy. That is called death wishes. Sometimes I don't want to live. I want to commit suicide now. This kind of thought always make it. That's called suicide ideation on that. Then sometimes the people may have physical, that is called somatic pains, whole body pain, headache. Sometimes they have a digestible problem. Sometimes they have a guilt feeling. Why should I live? I don't want to live in the world. What is the use for me? I don't have that kind of worth to live in the world. They may have a guilt feeling. Sometimes low self-esteem, feeling of tearful, always crying spells, weeping, feeling irritable, intolerant of others, feeling hopelessness, helplessness. These kind of symptoms are persisting more than 2 weeks in the individual, that may have a impact on daily activities. This kind of symptoms prolong more than 2 weeks, we must diagnose that the person have major depressive disorder. Sometimes their mood, they're feeling very sad, anxious. Sometimes they feel emptiness. Everything is there, but they thought themselves, nothing with me. I lost everything. I'm alone. This kind of mood always, they are predominantly present in the individual. They lost their interest in daily activities. Whatever they done it in the past, they not focused. They are not interested. They're not interested to do all the activities. So they simply avoiding or not feeling better to carry out all the things. Sometimes they feel energy very lost, decreased energy, having trouble in sleeping. sometimes wake up too early, or sometimes oversleeping. Then appetite gradually change. Sometimes appetite are completely reduced, sometimes taking more food on that. Sometimes they have a difficulty in concentration and making a decision. They have a thought of death or suicide. These kind of symptoms are found more than 2 weeks. The person is suffering from major depressive disorder. Another depression is a typical depression, atypical depression. If you have a typical depression, the symptom is decrease in appetite, weight loss, sleep disturbance, suicide ideations. At the same time, sometimes because of depression, people may use more smoking. Sometimes the smoking itself can develop a typical depression on that. The life events like any failure, any breakup, any feeling of rejection, any loss can have a contributor to develop typical depression. And any childhood trauma or any loss, any separation, any breakup, parental loss, these kind of things will be more impact to develop a typical depression. When come to the atypical depression, decrease appetite and weight loss, person feel low energy and hypersomnia. Sometimes people get more excessive sleep disturbance. Sometimes lead to paralysis. They won't physically, they are not very active. They are feel discomfort to walking on that. It is more common, especially female gender. It is more common. It is a yearly onset. The course of treatment, it is more persistent to anxiety. Typical depression is causes more persistent to anxiety and suicidality. When come to the atypical depression, persistent metabolic profile, the appetite and other hormone changes are predominantly changing in the atypical depression. Then another type of depression is persistent depressive disorder. It is mild to moderate, like a mild to moderate chronic depression. In this, the person feel very sad and always in a dark mood. It is common in most of the days. Nearly it is 2 years and more. If the person always feel to be very sad and darkness mood more than 2 years, it happened at any age. If the person is that major depressive disorder, 2 weeks. The symptom is 2 weeks. Here, the symptom is more than 2 years. If the person is more than 2 years, having feeling of darkness and sadness, withdrawal sensation, they are doing the work, but they are not very active on that. It will be occur at any age. For that, what is the treatment methodology for improving these symptoms? One is medications, psychotherapy, and lifestyle modification, which is more useful to overcome, to managing the persistent depressive disorder. Then come to the bipolar. It is a two extreme. In previous slide, we see the only depression. Now, two polar region is there. One is depression and mania. These two things simultaneously occurring in the individual. That is called the bipolar disorder. It is an extreme shift of mood, energy. Sometimes the people, some couple of days, they may be low energy. They have some depressive features. Some couple of days, they become more energetic, over familiarity, high self-esteem. This will be fluctuated ups and down. But with these things is there within the period of time, then it is diagnosed as a bipolar disorder. If you think the person is manic episode, feeling up very happy and excited, or sometimes they are very irritable also. Sometimes they have a lot of energy. Even 1 week before, he is very dull and withdrawn, never talk with others. After a couple of days, he became opposite direction on that. Very happy, excited, a lot of energy. The depressive episode even for the depressed phase, the feeling sadness, indifferent, or hopelessness with low energy. With these two episodes is simultaneously occurring in the individual, the person is diagnosed as a bipolar disorder. So then come to the postpartum depression. It is a very serious mental condition that occurs after the childbirth. Once a mother has given a child, due to changes in the biological aspects, as well as taking care of the infancy, they're getting inadequate sleep, sometimes no support system in the family, that develop depression after the delivery. That is called postpartum depression. What are the symptoms for the postpartum depression? One is feeling sad, hopelessness, and worthlessness, having difficulty in bonding with the baby. But taking care of the baby is highly difficult. Sometimes more aggressive taking care of the baby, feeding also very difficult. At the same time, withdrawn from others, having trouble in sleeping. Sometimes sleeping is too much. Having thought of harming self. Why should I live? What are the rationality for living? I want to die. I want to kill myself. I want to kill my baby. These kind of thoughts will be more on that. Sometimes they have a difficulty in concentration and making decision. Sometimes they have a severe anxiety and panic attack. So these symptoms will be very common in the postpartum depression. If these symptoms is started after the delivery of the child, delivery of the baby. So it is mainly very careful on that, because sometimes family may thought that because of the delivery pain, other thing, the mother having this kind of symptoms, but you not be avoided on that. We should be very careful on that to identify whether the person having postpartum depression or not. Then come to the premenstrual dysphoric disorder. This is a mood disorder, especially for the females, where before the menstruation period, they started feeling more pain. They started very distressed on that, because these symptoms are usually within 2 to 3 years after the period, it will be subside. But before the period, the patient starting feeling on that, they become more irritated, restless, irritability on that. So this is a symptom of premenstrual dysphoric disorder. Now come to the seasonal affective disorder. It is a type of depression that occurs during the specific season. Usually in winter season, people may get, it is also known as winter depression. The people, when they get winter, they feel very dull mood, and they withdrawn themselves, feeling very less energetic, and sometimes they have a decrease in pleasurable activity. When these symptoms, especially on the winter period, once the winter period is crossed, the symptoms will automatically subside. Sometimes the person have severe depression on that, they need some sort of medication and psychotherapy also. What are the symptoms on that? During the period, the person, especially winter, the person feels decreased energy, fatigue, or feeling slow down, difficulty in concentrating, remembering, or sometimes difficulty making decision, sometimes changes in sleep and appetite, sometimes unplanned weight changes, physical somatic body complaint like body pain, headache, cramps, and digestive problem. Sometimes in that period they have a decreased sex drive, trouble in thinking clearly, increase appetite, especially increase appetite in the sense sweet and carbohydrate related foods, they take on more that, because of to balance their mood on that. These are all the symptoms which is predominantly present in the seasonal affective disorder, especially this is in a winter season. It is also known as winter depression. So what are the causes for this seasonal affective disorder? Sometimes less sunlight and shorter days, that melatonin are decreased, they have a sleep related changes will occur because of the melatonin, and chemical changes in the brain. These are all the causes for seasonal affective disorder. But treatment is light therapy, psychotherapy, medication such as antidepressant, and cognitive behavior therapy, sometimes SSRI, which is very much required for this seasonal affective disorder. When the symptom is, in that also the symptom is predominantly severe in that. For that, this kind of pharmacotherapy is required. When the symptom is very mild, that can be manageable with psychotherapy and light therapy and cognitive behavior therapy. What are the best therapy for depression? We have seen a lot of different type of depression. All the researchers has concluded that based on the symptom, I told you mild depression, moderate and severe. Based on the symptom, treatment process has been modified. The severe symptom, definitely drug management along with the psychotherapy sessions. Then later, when the mild or moderate depressive symptoms, cognitive behavior therapy is very much advisable. Then mindfulness-based cognitive therapy and psychodynamic therapy and interpersonal therapy, which is mainly focused on how to manage this depression, the different type of depression. Then we'll talk about the bipolar disorder. So already I briefly discussed about bipolar disorder. In bipolar disorder, both mania, depression simultaneously ups and down. They occur in a single episode, or first episode may be a depression, second episode may be a mania. But both these episodes will be occur in a single person, that is to be diagnosed as a bipolar disorder. When the person in mania, how we can understand the mania? The person talk excessively. That is called, they can talk anything. If you started, how is life? They're talking everything in life which is not needed for us. When we are raising of thoughts, they are losing of association, talking everything, and that they are talking all type of things what comes in the mind. They don't understand the situation whether it is needed or not. Sometimes the person in mania, they have over familiarity. They are talking unknown people like a known people. Sometimes even the mania people may have more irritable hostility. Sometimes they're less sleep. Even they have less sleep, they feel is more energy. Even normal life, if you are not getting adequate sleep, we feel very lethargic. For the mania is concerned, they never sleep, but they have a full energy. Sometimes they have a delusion also, which is false fixed belief. They thought themselves they have a high power. Sometimes they thought about I am a messiah. Sometimes thought about God given all the power. I will change the world entirely within the 5 minutes. This kind of risk, this kind of delusional thoughts will be more dominating in the when the person is mania. When come to the depression, the other part of bipolar, sometimes first episode may be a mania. After a couple of days or couple of months, they have a depression. Sometimes first episode may be a depression. After a couple of months, maybe a couple of days or weeks, they maybe get into mania. What are the depression? Extreme fatigue, prolonged sadness, and memory loss. They can attention, concentration. They cannot review. Remote and recent memory will be disturbed on that. Sometimes they never take adequate food. They lead to poor nutrition. What are the triggering factor for bipolar disease? So one is insufficient amount of sleep. So sleep is very much required for our maintaining our bioorganism, especially for psychological, even for the mental health. Sleep is very much important. Even for our physical health, sleep is very important because our bioorganism will be balanced because of the sleep. Insufficient sleep may lead to certain bipolar disease. Sometimes if loved one rejected, feeling of high rejection, that person may be getting agitated, restless, irritability, sudden alter in the mood. Sometimes we are aware about alcohol and drug misuse that may lead to this bipolar disease. And sometimes people, certain antidepressant drugs itself can develop mania. Sometimes the dosage, the other mixing component of drugs may not be properly managed. They may lead to, sometimes the person may go for single depression, single episode depression, because the drug itself can develop mania. Then pregnancy, other hormonal changes, even pregnancy period, nowadays a lot of stress are there to maintain work-life balance. That is also lead to a lot of changes in the mental state. That is also lead to bipolar disease. And change in seasons. That winter season already I told you, September, August, July, this season, the climate change itself can develop certain bipolar symptoms. Then in bipolar, there is a bipolar 1, there is a bipolar 2. At least we should understand this. Instead of going deeply, we should understand. A person experiences full manic episode. See, in the bipolar condition itself, sometimes the person have depressive episode or manic episode. If this alter will be there, that became a bipolar. Sometimes bipolar 1 is the person have full manic episodes. So sometimes they have a hypomanic episode. The symptoms are very less. That is called bipolar 1. Bipolar 2, the person experiences elevated mood nodal hypomania. Hypomania is less intense and shorter duration of symptoms in mania. Mania is full-blown. Hypomania is all the symptoms will be present. The duration period are very less. The intensity also very less. So bipolar 1 disorder, at least one manic followed by the depression. Bipolar 2, at least one hypomanic. There is no full mania. There is one hypomanic and one major depressive disorder. That is called bipolar 2 disorder. Then another one is cyclothymic disorder. It is a mild form of bipolar. It is not a full form of bipolar. It is a mild form of bipolar. It's a period of hypomania depression symptom does not meet the criteria. Everything ICD and DSM-5 have certain criteria. Based on this criteria only, the psychological disorder has been diagnosed. So how can we cope up with the bipolar disorder? Definitely bipolar is concerned the shifting of mood very frequently, the biological very frequently alter because of the personality as well as life events. For that, how to manage this? Managing in the sense, definitely drug management is first and foremost treatment to balance this mood disorder. Then we should follow a strict and routine life. Then definitely it requires psychotherapy because this personality and environment not coping with each other, it alter the emotion and thinking process of the individual. Then it lead to depression or mania. For that, psychotherapy is very much required, especially CBT is very much required to balance that mood disorder. May not go for depression, may not go for mania, as well as sometimes if not giving therapy, the person may skip the medicines. If the person may skip the medicine, once skip the medicine, other alternative happen in the environment that again may lead to relapse and triggering factor for bipolar. So psychotherapy is very, very important. Then everyday exercise or moderate exercise are very much required to balance our mind and body, as well as avoid alcohol, other substance. This alcohol, other substance may develop depression and mania in the person. And at the same time, support system very, very important. When the family support system is not there, the entire treatment process will be failed. So family support system and social environment, working environment also, we need certain support. Sometimes this person may not work in the night duty. Sometimes the person have night duty and day duty. Night duty itself create another problem because the night duty itself will have an impact on the sleep. Once the sleep is disturbed, again the person may head into bipolar disorder. So working environment, support system, family support system is very much required to maintain this bipolar disorder, to managing the bipolar disorder. So another one is post-traumatic stress disorder. We are aware about that. Any traumatic incidents, that traumatic incidents which threaten the individual or that traumatic incident itself damage the person emotions and thought process. If after the incidents happen, the person will develop intensive feeling of fear, helplessness, and horror feeling. Once ever they thought like that, they develop this kind of disorder. So, what are the causes of post-traumatic stress disorder? One is top 4 reasons for men and women who suffer in the PTSD. For men, rape and very blasted exposure and childhood neglect and childhood physical abuse. They develop post-traumatic stress disorder in male, especially in female, rape, sexual molestation, physical attack, being threatened by the weapons. That gives lot of dramatic changes in the emotion as well as the thought process. When the symptoms, below that we are going to discuss about the symptoms. When these symptoms for longer period or 4 weeks, more than 4 weeks, it gives a lot of distress in the daily activities. For the children, they don't get sleep, they don't talk with others, they are withdrawn, they cry in spells, they are scared about seeing the people, they never go to school, all the things. These kind of symptoms are more than 4 weeks, that give distress to the children. Or for adult population, they never discuss, they always personal hygiene will deteriorated, communication deteriorated, socialization deteriorated, all the social occupational impairment will interference in the day-to-day daily activities. What are the symptoms on that? The sign and symptoms is effort to avoid thought process. They never, what they thought themselves, they never express on the thought blocking is there, and avoiding all the activities or social gathering or going out or daily activities, they are avoiding. Then the memory is disturbed, and then they never show any pleasant and pleasurable things. They never show any emotion like happiness or joyfulness. Avoided, feeling of detached, always detached from others, feeling of flat, sense of shortened for shortened period, flashback. Whenever they have this kind of symptoms on that, they bound to develop certain things. Other symptoms like difficulty with sleep, irritability, they'll always anger, they become hyper vigilant. Whenever anyone going very near, they become very scared. Suppose anyone touch, they become very scared. Even known people, even brothers, sisters, or parents, they become more hyper vigilant. They become more scared on that. Difficulty in concentration, and they have a sudden subtle responses in the biological rhythms and intrusive thought. The repeated, uncontrolled, obsessed thought will be more on that. After that, situations. What are the therapy available for this post-traumatic stress disorder? One is talk therapy. We, in psychotherapy, mainly ventilating all the suppressed and sorrow information. This talk therapy is very much required on that. Then trauma-focused cognitive behavior therapy. It helped to change the deal out to stress. What are the events? After the events, how they perceived, the changing the perception, remembering the events, and support system developed, and the thinking pattern has been changed in the trauma-focused cognitive behavior therapy, which is more useful. And PTSD, one famous therapy is called eye movement desensitization and reprocessing, EMDR. It very much required, very much clinically practiced to managing the PTSD features and symptoms. Then narrative exposure therapy, whatever comes in the mind, whatever they visualize, whatever they cross, all the thing has been narrated. And with the narrating all the things, we try to correcting the process and make the emotions and mood will be very stable. Then stress inoculation training, especially it is a type of CBT, help dealing with the day-to-day stress. After the incident, the person may prolong suffering with the stress. That time management, stress management technique, catharsis, all the things can be taught to the patient. Once, suppose along with the therapy, they have more biological started symptoms. In that situation, person may require medication also. Then come to the other very important mental disorder is schizophrenia. This is a disorder which is very chronic and more disability on that. It is Usually it is emerge in men late teens to early 20s, in female mid 20s to early 30s. Many people with the disorder have difficulty holding a job because this schizophrenia will have a lot of changes in the brain functions. The frontal lobe syndrome, the emotional area, reasoning ability will be disturbed. At the same time, uh, um, executive function, any job, any task, we have to execute what we have in our mind. This kind of executive functions will be more disturbed in schizophrenia. So they bound to develop negative symptoms on that, because lack of motivation, lack of environment, lack of interest, withdrawn, no socialization. These kind of symptoms are called negative symptoms. If the person will have chronic schizophrenia, they develop negative symptoms. In schizophrenia, a lot of other types. One is paranoid schizophrenia. The person have hallucination. The absence of stimulus, they're hearing something, they're seeing something, even nothing will be there. The people will thought of somebody is following me, somebody tracking me, somebody through camera, somebody hacking my mobile. These kind of false fixed belief system will be more common in the paranoid schizophrenia than unorganized schizophrenia. This is another type of schizophrenia. Speech and behavior are not organized. They're jumbling in the speech. Sometimes one sentence and formation is highly difficult. Then catatonic schizophrenia, it is a multiple psychomotor abnormality. They are rigid in body posture, like sometimes they stand like a statue. This kind of symptoms, they never body movement will not be there. Very restricted body movement. It is called catatonic schizophrenia. Then it is undifferentiated. Sometimes schizophrenic symptoms may not be present. The criteria may not be present, but seems to be like some of the symptoms seems to be like a schizophrenic symptoms. It is called undifferentiated. Residual schizophrenia, it is severe symptoms. It lack in the personal hygienic, total personal hygienic will be absent, and then they become very shabby and take the food from the dustbin, they sleep on the roadside, they're not properly dressed. These kind of schizophrenic patients are called residual schizophrenia. What are the causes of schizophrenia? One causes in the family members, anybody have suffering with the schizophrenia, there is a possibility of getting schizophrenia in next generation or children's. Another one is life experience. Any traumatic life experience may have a lot of impact in a mind process. The emotion and thought process will be disturbed on that. Another one is living with the poverty, suffering with for daily needed daily amenities. That is economic problem also lead to a lot of distress in the individual. Then prolonged stress or prolonged dangerous situation may develop schizophrenia. Sometimes some pregnancy period or some complication in birth issues, it's also developed schizophrenia, low nutrition, and after the low birth weight, exposure to the toxins and virus before birth, they affect brain development. That's lead to schizophrenic symptoms. Sometimes this psychoactive drugs, psychotropic drugs, especially substance, which is very common in the teenage period, especially for cannabis, which more if the person using cannabis is more vulnerable to develop schizophrenic symptoms and schizophrenia. So when the person suffering from schizophrenia, definitely medication is the first line treatment, antipsychotic, and sometimes the person may have with schizophrenia, they may have mania, they may have depression. For that, mood stabilizer will be useful. Other type of drugs also useful for that. Then not only sometimes, not only drugs. Suppose the person have positive symptoms like hallucination and delusion, hearing voices, thought commanding, somebody following, somebody tracking, somebody giving, somebody against me, somebody mixing poison in my food, they try to harm me, kill me. These kind of symptoms are called positive symptoms. For that, drug is very much required. Followed by psychotherapy, also very much required, because this psychotherapy will help to remodify the thinking process and emotional process along with drugs. Sometimes another symptom is called negative symptoms. The lack of motivation, lack of involvement, apathy, anhedonia, not doing any work, even personal not taking bath. This kind of the symptoms belong to negative symptoms. It is a negative side of schizophrenia. For that, life skills program, communication, other rehabilitation program, which is very much required along with the medication. Then art therapy, dance therapy, drama therapy, group activities are very much required to manage schizophrenia patient to better improvement. Then come to the eating disorder. Eating disorder is a serious illness characterized by distressing regarding someone. Someone thought that I am obese. Someone thought that I want to be very lean and structure shape. For that, they modified themselves in a food pattern. That time, that things which lead to certain disorders like anorexia nervosa, bulimia, and binge eating disorder. We'll see one by one. So, what are the factors? What are the factors will have a root cause to developing eating disorder? The person will have low self-esteem. The person will have poor body image. I'm not good looking. I'm very dull. I'm not approved by others. People are rejecting. I'm not comfortable with this appearance. This kind of negative thought about the external appearance, that is called poor body image. Sometimes person become anxious, person become more depressed. Sometimes peer group pressure, and nowadays media is more influencing the youth and individual, and exposed to the people. Sometimes people who exposed to the people who are having this kind of similar disorder, they influence in the influence to develop in the eating disorder. What are the common type of eating disorder? One is anorexia nervosa. People with anorexia nervosa severely avoid or restricted food intake due to distorted self-image or intense fear gaining weight. Another one is bulimia nervosa. People with bulimia nervosa regularly binge eat and then engage in unhealthy behavior to prevent weight gain, such as sometimes they take food and they themselves forced to get vomiting on that. Use of some drugs, sometimes with putting a finger on the mouth or getting vomiting on that. Another one is binge eating disorder. People with binge eating disorder regularly lost control of their heat and eat unusually large amount of food. They never have restricted time. They never have a proper time to take food. That is called binge eating disorder. Then another one is avoidant restricted food intake disorder. People with this, the amount and variety of food they eat due to their anxiety. Sometimes I told you one of the basic symptom of anxiety is being anxiety and depression. Sometimes people restricted or rejected food. Another extreme says sometimes people are taking more food to balance the depression anxiety. Those people comes under this avoid and restricted food intake disorder. What are the therapies of eating disorder? Again, psychotherapy and physical activity and family-based therapy, nutritional therapy, and occupational therapy. That's called as cognitive behavior therapy. Another interpersonal therapy, family-based acceptance commitment therapy, and psychodynamic psychotherapy, which very much required to managing this eating disorder. Sometimes in the eating disorder, other comorbidity like depression, suicide, or anxiety, the high intensity of suicide, people may need certain pharmacology-based treatment followed by this psychotherapy, different type of psychotherapies. Then come to the personality disorder.
Sir,
Sir,
excuse me, sir. Yeah,
yes, sir. Yes, sir.
probably we can close the presentation.
Yes, sir.
And we will take up some. Can you take up some questions, please?
Yes, sir. Yes, sir.
Okay, all yeah. So you can stop your sharing, sir.
Yes, sir.
Yeah. Dr. Bharati has raised the hand. Participants, yeah, you can come up with your questions. Doctor is available. Mr. Mohan, kindly unmute their mics. Only the participants who have raised their hands. Other participants,
Done,
please
sir.
see to it. Yes.
Good
Other
evening,
participants,
sir.
please see to it that your mic is muted.
Good evening, sir.
Yes,
Good evening,
Dr.
madam.
Bharat.
Please,
Okay.
Sir, I have two questions to ask, sir.
Yes, madam.
The first one is how we can differentiate the internal monologue and just thinking.
Again, make it some example, madam. Make it clear.
The voice which we can hear in our mind, internal
Okay.
monologue and just thinking, how we can differentiate these two.
Again, madam. I'm not getting.
How
No, she's
we can
asking the difference
differentiate.
between hallucination and internal monologue, sir.
See, hallucination is there is no stimulus. There is no stimulus. Person himself developing certain images, certain thoughts, certain things which is happening in and around. It is in a thought-related disorder. The person may have a distortion in the thoughts. Sometimes this is called hallucination. It's a deviate from the normal phenomenology or deviate from the normal reality. For example, the person may thought that my family members are mixing poison in my food. Before taking food, they try to find any things are there in the food. And the same time, sometimes they ask the other people to eat. After that only they will eat. Here is the family culturally not followed that, killing their own. Very rare abnormal cases are there. But in our normal culture, it won't be happen. The person may develop certain thoughts because he feel that my family members are against me, my family members not rejected me, my family members not understanding me, my family members not giving important to me. This kind of emotional thinking process make the person to be distorted in thought process. That is called deviated behavior or abnormal behavior. It is a false belief that only followed by the person. Madam, you understand this one?
Yes, sir.
Another one is we have lot of distress on us. Sometimes we are murmuring on that. Sometimes this murmuring, we can understand over a period of time, our thought process, we try to think rationality and control over that. It is within us. Sometimes the person will hallucinate when the external environment, that external environment is not controlled by me, not within me. They develop thought distortion for that hallucination. That lead to hallucination. Can you understand, madam?
Yes, sir. And my second question is how dangerous our inner monologue can be, sir? Or in what way it can affect our mental health?
Definitely, madam. If you are indulged within you, definitely your social occupational area will be damaged. Your communication part will be damaged, socialization part will be damaged, and developing interpersonal relationship, adjusting the environment will damage. These things damage, it is away from the withdrawal. This withdrawal is away, we will ruminate it, may develop anxiety or depression, or maybe go for schizophrenia also later life. It will be prolonged.
Okay, sir. Thank you.
Sir,
Yes,
there
sir.
is a question in the chat box.
Yes, sir.
Anybody who has raised wants to ask any question, please, participants. Just now I saw that question. When I put that question, I actually can come up on the screen and if a person diagnosed as bipolar disorder and he had already gone through depressive episodes and currently experiencing manic episodes,
Yes,
is
sir.
there any chance to experience depressive episodes again?
Sir, there is a possibility, sir. There is two theories available to manage bipolar. In psychotherapy, there is a two theory. Down drift theory is there, and down theory is there. If you read down drift theory, down theory, we can understand how this mania and depression as simultaneously exist in the individual. The another one is there is even in a bipolar single episode, first episode, for example, first episode 2 months back, the person have an episode like mania. There we diagnose as a unipolar mania. Then later 2 months, because of the drugs or absence of the drugs or relapse, again the person may develop depression because they may be thought about the life events and then losses and then failures. Again, the person will go for a depression. This now we diagnose as a bipolar. Even that bipolar, again the person may get depression, again the patient may get mania. It is a possible. If these things may not be happen, first line treatment is drugs. Second line treatment is we have to find out what are the triggering factors. What are the possibilities of getting relapse? Relapse is again occurring. If these psychosocial things can be managed with the psychotherapy, the person may not get again depression, again manic episode. If these things are not monitored, whether regular drugs are not there, no family support, no psychotherapy, definitely in the environment, triggering factor. Suppose, for example, work-life imbalance, again facing any failures, again facing any detached, any problem, any traumatic events, there is a possibility of getting again depression or mania.
Hold on. Yes. What kind of therapy is best suited for eating disorder?
Sir, definitely for eating disorder, CBT and life skills very much required, sir. That belief system, mainly focus belief system, the concept which is framed by self, that can be modified, that thinking, distorted thinking and irrational belief can be modified through psychotherapy, especially CBT. And life skills are very, very important. Because of the lacking in the life skills, they withdrawn from the society, never adjust with the people. Communication and social skills all very much required.
So thank you very much, sir. We have covered lots of the psychological disorders, their causes, therapy, and the remedies, medications. You have covered in your many angles to deal with this, many of the psychological disorders, sir. Thank you very much for your wonderful presentation. Now,
Thank you, sir.
before we, sir, please come on the video. Before
Yes,
we go to the formal vote of thanks by Hepzibah. Hepzibah, are you online? Mr. Mohan, kindly. Hello, Hepzibah. Sir, kindly come on the video, please.
Yes, sir. Yes, sir. 1 minute, sir.
Sir, Radip,
Yes,
sir,
sir.
kindly come on your video.
Yes,
We
sir,
don't
sir.
see
1
you.
minute,
Yeah. Sir has come. Sir,
The
kindly
screen stop பண்ணுங்க சார்.
stop sharing.
yes, sir. Yes, sir. 1 minute, sir.
Yeah.
Yes, sir.
Fine. Now, participants, I request all the participants to come on the videos. We'll have some screenshots with the Dr. Sandeep Rajkumar. All of you, please, turn on your videos, please. Because yesterday we couldn't take some screenshots. Mohan, So we are all ready. So keep on smiling for 30 seconds. Yeah, I see Sain is sitting on the staircase. She's doing her internship in the Calicut. Yes. All right. Mr. Mohan, so you can take different frames. So keep on smiling. Dr. Anuradha, you're not smiling. Please smile. Yes.
Sir, done, sir. Sir, done, sir. Thank you, sir. எப்சிபா நீங்க vote of thanks சொல்லலாம்.
Am I audible? Good evening, everyone. I would like to express my heartfelt gratitude to everyone who made this certificate course session a meaningful and enriching experience. First and foremost, a sincere thank you to our esteemed resource person, Anjit Rajkumar Deva and education. Your insight, your insights into the challenges faced by individuals with intellectual disability, psychological disorders, the importance of early interventions, the role of effective communication strategies were truly valuable. Your session has deepened our understanding and will surely guide us in our future practice. A special thanks to the Department of Counseling and Psychology, St. Joseph's College, for organizing this insightful session. I also extend my gratitude to all participants for their enthusiasm and engagement, which made this session truly interactive and insightful. A sincere thanks to our technical team for their efforts in managing the online platform seamlessly, ensuring a smooth and efficient experience for everyone. Once again, thank you all for your time and participation. Wishing you a wonderful evening. Amen.
Yes, thank you, Jasmine Epsiba. So thank you very much. So participants, if you have any doubts and clarifications about the submission of assignments and other related matters regarding the certificate course, I am available now. I can take some questions and doubts. Sir, thank you very much. Yes, thank you.
No, hello, sir. Good evening.
Yes, good evening.
Sir, this is Shivaram. I was a postgraduate student of English literature before. Now I am in Nepal. I texted you a few days back. I would like to pursue my studies in psychology, sir.